Hello, this is Dr. Paul, and we'll continue to go on our journey on healthy after halftime. Before we dive into any healthy nutrition, first, we all have to make sure that we talk about hydration. So the question is, how much water do you need every day? And if you're not exercising a regular day, you probably should have 100 fluid ounces of water a day. So if you drink 8 glasses of an 8-ounce amount of water, which is 64 fluid ounces a day, you should be doing fine because the rest of that will be made up with coffee and fluids in your food. So that is your baseline. But if you're exercising and you sweat a lot with your exercise, I strongly suggest that you drink 8-ounce glass of water before you exercise and 8-ounce glass of water after you finish exercise. And if you sweat a lot doing exercise, you should possibly and probably continue to have 32 fluid ounces of fluids while you're exercising. You do not ever want to fall apart and fall behind of your fluid status and become dehydrated. So what's the problem of being dehydrated? Well, you may develop muscle weakness and cramps, which is very common. You'll find out that your heart rate is running faster than usual. And in fact, by the time you get a little bit cool and clammy, a little bit nauseated, you will probably feel like that for the rest of the day, even though you try to rehydrate. So catch up never works. You got to really drink enough to prevent this from happening. A very short note on electrolyte water, which is extremely common out there, very expensive, 10,000 different brands. And really, it's not for any one of us. I think that if your exercise is less than an hour, you definitely don't need electrolytes. Water will be great. But if you're a triathlon, you're a marathon runner, you are sweating and exercising more than an hour or two, then probably some electrolyte supplementation will be helpful. And that will be on another lecture for another day. The second thing I want to talk to you about is before you understand what is healthy nutrition and why, or why should we exercise, or why should we pay attention to our sleep, I think you need to understand the basic premise of what makes us sick, which is inflammation. So what is inflammation? It is our body response to a temporary insult and try to heal it. So I'll give you an example. If you have the cold or you have a strep throat and you develop some high fever of 102, that is an appropriate response of your body to try and kill the bacteria or the virus. And when the immune system in your body kicks in, and the fever will eventually resolve. So that is a good thing. We have to have it to protect ourselves. However, we need to discuss when inflammation becomes dangerous. What that is when it does not go away and it lingers on for months, if not for years. Some good examples will be diseases that you are ignoring because you think it's just allergies called chronic sinuses, or you have dental abscess you don't even know you have because there's no pain or swelling, or you keep smoking heavily, you don't take care of your diabetes, or you might even have a silent cancer hiding that you don't have any symptoms for, just to name a few. But ignoring these persistent chronic inflammation will damage your healthy cells and organs and eventually will kill you. So it is a really silent killer because most of the time you have no idea. So here it is. I'm going to try and give you some insight into some of the symptoms of inflammation. And if you have it, you might want to start looking into that, especially if it lasts for a few months now. Number one is persistent pain. Even though you did not hurt yourself, you do not have arthritis, and yet you do have muscle aches and joint aches. You are chronic fatigue and you're not sleeping well, or you always have joint stiffness, but you don't know why. Your bowels are out of whack. You might be constipated today, diarrhea tomorrow, or you might have heartburn suddenly, even though you never had it before. Those are bad warning signs. And if you're depressed and anxious and you have mood swings all the time suddenly, and the more important and common ones is you tend to seem to get frequent colds and flu and seems to get sick a lot. Those are all the common symptoms that you should pay attention to, because then it is time to find out why your body is inflamed. Your doctor has certain blood works that can be done, and there will be certain exam and tests that should be done to try and look for trouble. Because if you can catch it early, you won't have any further permanent damage. This is all I want to talk about today. So think about your hydration, think about inflammation, so that next week we'll dive into things that we can do, from nutrition to exercise to sleep, etc., about how to decrease our body's inflammation so we can live long and prosper and feel good all the time. Thank you very much for your attention. I'll see you next week.